Layton, and I'd like to check in.
Who's your physician?
Dr. Craig.
Here we are. You're scheduled for a cardiac scan.
Among others. I've been through this before.
Oh, yes, I see. You were in last year for a bypass.
I thought that was the end of it.
Did you bring any valuables with you?
No, last time I was here, they cleaned me out.
Husband is deceased, is that correct? Who's your next of kin?
Oh, my sister Claire, I guess.
Good morning, Eve. 8 o'clock, you're very prompt.
Dr. Craig, I'm sorry I called so late last night, but the angina episode really scared me.
Don't be silly. If you think there's a problem, the best solution is for us to find out.
I took a week's leave. Is that going to be enough?
Well, I won't know, Eve, until I see your test results.
Sign here, here, and here. Press down hard. There are 4 carbons. Your room isn't ready yet. Just be seated, and someone will come and take you in.
Thank you. I thought your work came with a 50,000-mile warranty.
That's right. I've invested too many years taking care of you to let a little angina get the best of us. Here we are. Hop in. I'll take this myself. What's the room number?
3826. But Dr. Craig is still not ready.
Oh, for Pete's sakes. How long do you people take? I'll make the damn bed myself.
Joan Halloran. She's the new City Health Services advisor. Today's her first day.
Oh, just what we need. Another politically appointed know-nothing sticking a nose where it doesn't belong. What?
Here are the results on the cardiac scan you ordered on Eve Layton. Doesn't look too good.
I'll be the judge of that.
Dr. Westfall, love what you did in the ER. I always thought the parking lot was a little small.
Thanks very much.
Anytime.
Oh, damn. Take a look at these. 1 year ago, she had an MI on the cardiac catheterization table. I performed an emergency triple. Outside of her heart, she's in perfect health. It just doesn't look like it's going to hold out much longer.
According to this, there's marked hypomobility in the left ventricular anterior and inferior walls.
Notice the ejection factor, 20%.
Oh, boy. What are you going to do?
I've only got 2 options. I can let her die or do a heart transplant.
PR isn't all I'm here for, Dr. Auslander. The mayor's under a lot of pressure to balance the budget. He's put me in charge of making sure the city-owned hospitals run as efficiently as possible.
Well, if I had to make budget cuts, I'd start with health care, too.
Well, Miss Halloran, I don't think the city could accuse us of being frivolous in any way.
Well, now it's up to me to make that determination.
You know, I have a daughter about your age.
Miss Halloran, if you have any questions or anything you want to discuss, you give me a call, will you? By the way, Daniel, I was talking to Mark a little while ago. Mark Craig, he's our chief of surgery.
I know.
He wants to do a heart transplant.
That's wonderful. He'll be our first.
Yeah, maybe we'll get some goodwill publicity on the side, huh? Anyway, I told him to go ahead and get the ball rolling. What do you think, Miss Halloran?
Absolutely not. Dr. Craig, I wanted to introduce myself. I'm Joan
What are
Halloran.
you doing in here without scrubs on?
Joan Halloran, the new City Health Services advisor.
Oh, yeah, right. Yeah, well, you still have to wear scrubs in here. That is, unless you political types no longer carry bacteria.
Dr. Westfall told me this wouldn't be easy.
What?
Don't get me wrong, Dr. Craig. You've done a great job turning this into one of the top surgical units in the state.
All right, let's stop the soft soap. What do you want?
Okay. Dr. Westphal brought up the possibility of you doing a heart transplant here at St. Eligius.
Good news travels fast.
Not as fast as bad news. I can't authorize the funds.
What do you mean?
The costs of putting together a special surgical team, not to mention the necessary equipment,
Now,
would just...
look, lady, I don't know whose daughter, granddaughter, daughter-in-law you are that got you the job that you've got, but I am not about to let you tell me how to run my department.
I'm afraid you have no choice. And being rude isn't going to get you what you want.
And being a political shill is not going to keep Eve Layton alive. Now, why don't you go tell her that you're condemning her to death in order to save the city a few lousy bucks?
We're not talking a few lousy bucks. The mayor is going to close this place down. Do you understand that?
You're not talking to a moron.
It's a question of priorities. If we don't get the budget under
Listen,
control...
if you're so interested in cutting back on unnecessary spending, I suggest that you start on your job.
This isn't getting us anywhere.
Fine. Now, tell the mayor that if I don't do that transplant, he's got to find himself another chief of surgery. Now, get out of my way.